Hi friends, greetings of the day. Today we will discuss about infant with hypotonia or floppy infant. First we will discuss about the definition of hypotonia. Hypotonia is nothing but decreased tone. Tone is normal resistance to passive movements, which is the resistance to passive movement is called tone. Resistance to passive movement is called tone, which is a normal phenomena seen in everyone. So if this tone is absent or reduced, it is called hypotonia. So if this normal resistance to passive movement is reduced or absent, it is called hypotonia. So if this tone is reduced, it is called hypotonia. The children with hypotonia are also called as floppy infants. When you passively move the limbs of the anyone, you will feel mild resistance. It is called tone, which is normal in phenomena in everyone. If this tone is reduced or absent, it is called hypotonia. Causes of hypotonia can be predominantly divided into central or peripheral causes. Okay, central nervous system or peripheral nervous system causes. The central nervous system causes it is important to differentiate between the central nervous system and peripheral nervous system. First step to evaluate the hypotonia is to differentiate between the whether it is central nervous system cause of hypotonia or peripheral nervous system cause of hypotonia. Central nervous system or peripheral nervous system. This is mainly done, the difference can be done mainly by clinical features. Central nervous system causes are mainly due to defect in brain or spinal cord. The clinical presentations of central nervous system causes are presence with irritability, microcephaly, encephalopathy. Encephalopathy is nothing but the brain, the reduced function of the brain, which is presented as lethargy, decreased consciousness, seizures, etc. Okay, that is called encephalopathy. Dysmorphic features, like in genetic syndromes, you will see the dysmorphic features. Like in Down syndrome, you see low set ears, simian crease, high arched palate. So in central nervous system hypotonia, you can see the in some genetic syndromes dysmorphic features. Seizures are seen. So in central nervous system, seizures, encephalopathy, dysmorphic features, microcephalic can be seen. The the important distinguishing feature is here in central nervous system there will be normal strength and normal deep tendon reflexes. There will be normal strength but decreased hypotonia. Strength means the power. Power is resistance to power is like movement of the limbs against the gravity, movements of the limbs. It is called the power is the strength of the active movements done by the child, whereas tone is the resistance to the passive movements, whereas power is the active movement. So if the movement is good, if the child is moving if against the gravity or against the resistance, then we can say there is normal strength. So in central nervous system causes of hypotonia, there will be normal strength, and the deep tendon reflexes also will be normal. Okay, and deep tendon reflexes will also be normal. So it is an important distinguishing feature from peripheral nervous system causes, whereas in peripheral nervous system causes there will be decreased strength and decreased deep tendon reflexes. Okay, and causes of the central nervous system hypotonia are genetic abnormalities like trisomy 21, that is known as Down syndrome, Prader-Willi syndrome, and Zellweger syndrome, which presents with seizures. Okay, next is cerebral malformations, hypoxic ischemic encephalopathy, which presents as cerebral palsy. So these are the central nervous system causes of hypotonia. Genetic abnormalities like Down syndrome, Prader-Willi syndrome, Zellweger syndrome, which present with seizures, cerebral malformations like holoprosencephaly, and other features of some other malformations of the brain, hypoxic ischemic encephalopathy, which presents as cerebral palsy. So these are the central nervous system clinical features and causes. Next we will come to peripheral nervous system. Presence with the generalized weakness, generalized decrease in strength, and decrease in deep tendon reflexes. It's opposite. In central nervous system there will be normal strength and normal deep tendon reflexes. In peripheral nervous system there will be decreased strength and decreased power and decreased deep tendon reflexes. Generalized weakness and decreased deep tendon reflexes means the child will not move, there will be no movements will be very weak, so a generalized weakness will be there. And there will be decreased movements in uterus, the fetal movements will be decreased in the uterus, and there will be no dysmorphic features. Whereas in central nervous system there will be dysmorphic features, whereas in peripheral nervous system there will be no dysmorphic features. The peripheral nervous system causes are mainly broadly divided into the etiology, where the defect is present, location of the defect, whether the defect is in anterior horn cell or neuromuscular junction or in the defect in the muscles. So it is broadly divided into three types according to the location. The defect in anterior horn cell is classically seen in spinal muscular atrophy. In spinal muscular atrophy, it is mainly due to the mutation in the SMN1 gene, survival motor neuron gene. The diagnosis is by molecular analysis of this SMN1 gene, which may be absent or grossly reduced. The clinical features depend on the presence of this SMN1 and SMN2 genes. Okay, if it is grossly reduced or absent, the clinical features are very much dangerous. Whereas if it is present in minimal amounts or moderate amounts, there will be less clinical features, less complications. Okay, it presents the same as all peripheral nervous system causes. It presents as generalized weakness, but to differentiate between other causes of peripheral nervous system, you can say there will be normal facial expression, faces will be normal, and extraocular movements will be normal. Means the facial expression will be normal, means there will be no facial muscle weakness. Like in neuromuscular junction there will be facial nerve weakness and there will be oculomotor nerve weakness leading to ptosis, and facial weakness, neuromuscular junction problems. Whereas in muscle problems there will be abnormal faces like triangular mouth and the facial expression will be absent. But in spinal muscular atrophy the facial muscles are spared, like normal facial expression will be there, faces will be normal, and extraocular movements will also normal. Okay, but in spinal muscular atrophy the social milestones of the child are normal, the intellectual ability and social milestones of the child are normal. Means there will be normal facial expression, like a social smile is present and he recognizes the mother, so he is intellectually normal baby. But only problem is his hypotonia, his gross motor and fine motor milestones are abnormal due to hypotonia and anterior horn cell defect. His social and cognitive milestones are normal. Okay, diagnosis I already told you. Early detection and treatment of SMA is spinal muscular atrophy is very important, because it can be curative. So if you detect the SMA before 6 months, then it can be curable. So early detection is very important because there are good novel therapies like gene therapy, and there are some latest medications available for SMA. So early detection is very important. Fasciculation of tongue will be positive. So in exams they will ask that the child presents with the generalized weakness, with normal facial expression and normal social and cognitive milestones with no dysmorphic features, and fasciculation of the tongue present, and fetal movements are reduced, then you can select the option as spinal muscular atrophy. The diagnosis of choice, they will ask question as diagnosis of choice, then you can say SM1 gene molecular analysis. Okay, next we will come to neuromuscular junction problems. Here the classical disease of neuromuscular junction problem is congenital myasthenia gravis. Here there will be facial weakness. Unlike the SMA where there will be no facial weakness, here you can see facial weakness, ptosis will be there, and fluctuations in presentation. Like early morning there will be more more weakness will be there. As the day progresses, the weakness and symptoms will be reduced, so there will be fluctuations in presentation. And all other features of peripheral nervous system like generalized weakness, decreased deep tendon reflexes are also present in neuromuscular junction problems. So they will ask question like there is facial weakness, ptosis, and generalized weakness, and decreased deep tendon reflexes. So mainly congenital myasthenia gravis differentiates from SMA by this facial muscle weakness. Facial weakness will be there, and also ptosis weakness will be there, and also ptosis can be seen. So if they ask question like this, you can select the congenital myasthenia gravis. Next, if we come to muscles, the classical disease is congenital myotonic dystrophy. Here there will be abnormal faces, unlike SMA where there is no abnormal faces. Here there is abnormal faces. Triangular mouth is present. There will be poor swallowing will be there. Due to this, there will be history of polyhydramnios, may need nasogastric tube feeding. Okay, poor swallowing will be there. History of due to this, there will be history of polyhydramnios in the mother, because the baby will not swallow the amniotic fluid due to poor swallow. Due to this, polyhydramnios will be present. May need after delivery, baby cannot swallow the milk, so she might need or he might need NG tube feeding. Same like other features of peripheral nervous system causes, there will be decreased deep tendon reflexes and generalized weakness, along with facial expression will be absent. Facial expression will be reduced or absent, unlike in SMA where facial expression is spared. Here facial expression will be absent, and respiratory muscle weakness will be seen in the initial stages, whereas in neuromuscular and anterior horn cell, the respiratory muscle weakness is seen in severe and final stages of the disease, whereas in myotonic dystrophy it is seen in early presentations. May need ventilator support. Other differentiating feature is in myotonic dystrophy there will be club feet often associated. In adults with myotonic dystrophy, the cataract, myotonia and diabetes are present. So they will ask question, what is the cause if there is abnormal triangular faces and club foot is present, and facial expression is decreased or absent. Club foot, and there will be history of myotonia and cataracts etc. in mother. So then you should select congenital myotonic dystrophy. So they will ask the questions on depending on the clinical features. Here mainly decreased fetal movements, fasciculations are present, normal facial expression, and faces and extraocular movements are present. First we should differentiate between central and peripheral. In peripheral nervous system there will be generalized weakness and decreased deep tendon reflexes and no dysmorphic features. After differentiating, when they ask question, if it is peripheral nervous system, if you find it is peripheral nervous system cause, then you should differentiate whether it is anterior horn cell defect, neuromuscular junction defect, or muscle defect. In anterior horn cell defect there will be they will ask question like this: decreased facial, normal facial expression, normal faces, extraocular movements are normal, no dysmorphic features, and fasciculations are present, decreased feature movements. Then you should select spinal muscular atrophy. Here they will ask facial weakness, ptosis, and all other features of peripheral nervous system. Mainly the facial peculiarities, ptosis and facial weakness. Then you should select neuromuscular. Here they can ask triangular mouth, decreased facial expression, and history of and also club foot and history of myotonia in the mother. Then you should select congenital myotonic dystrophy. Other causes of peripheral nervous system hypotonia or congenital muscular dystrophy. Here congenital myotonic dystrophy, which is problem in muscles. This is congenital muscular dystrophy. It also presents same as peripheral nervous system, generalized weakness and decreased deep tendon reflexes. And congenital myopathy. In congenital myopathy, the fasciculations are absent. Okay, these are the congenital muscular dystrophy and congenital myopathy or other causes of peripheral nervous system hypotonia. There is mixed or other causes which are neither central nervous system nor peripheral nervous system. There are mixed and other causes called sepsis, hypoglycemia, hypothyroidism. So in neonatal sepsis, neonatal hypoglycemia and also hypothyroidism, you can find the hypotonia. It is important to detect hypoglycemia because sometimes in ICUs the patient will be the important source of the main source of glucose to the patient will be IV fluid. Sometimes when in between the monitoring, sometimes there will be block or displacement of IV fluid leading to edema, leading to improper supply of the IV fluid because of displacement or displacement or removal of that IV cannula. The IV fluid will be supplied very less to the baby. So if you and the mother will complain of decreased activity, lethargy in PSU or NICU. So you should never ignore that. If mother complains of decreased activity, baby is having decreased activity, lethargy than before, then check the IV cannula, check the fluid and also check blood glucose, because it is important cause of lethargy and it is easily treatable and you can save the life of the baby. If you miss, he will go into seizures and it is life threatening. So important to detect hypoglycemia, never miss in your practice. So this is hypotonia. Mainly you should differentiate central nervous system and peripheral nervous system causes, and also in peripheral nervous system you should differentiate the different diseases. Thank you very much. If you like my video, please press the like button and subscribe to my channel. Thank you very much.